Welcome to The Explainer. Today, we're diving into something called a ventral hernia. Now, you might be surprised to learn just how common these are, especially after surgery. We're going to break down all the latest science on how they're diagnosed and fixed, pulling from a fantastic review in the BJS Open journal.
All right, let's just start with this number because it really sets the stage. Up to 30%. That's a pretty big number, right? But what does it represent? Well, there's your answer. That's the percentage of people who might end up with a hernia after having major abdominal surgery. So we're not talking about some rare complication here. This is a very real issue that can cause a lot of chronic pain and seriously impact a person's quality of life. So what is a ventral hernia exactly? Well, think of the strong muscular wall of your abdomen. A hernia is basically a gap, a weak spot in that wall. And that little defect allows stuff from inside, like your intestines, to bulge out, creating a lump you can often see and feel. This image shows it perfectly. On the left, you've got a nice, solid abdominal wall. Everything's contained. But on the right, you can see how that weak spot, that defect, creates an opening for the abdominal contents to push their way through. That bulge is the problem that surgeons have to solve.
Okay, so we get what a hernia is. But how do surgeons figure out the best way to fix one? Well, it all starts with sizing up the problem, because no two hernias are exactly alike, and the game plan for fixing them has to be just right. And this is just so critical. Classifying the hernia isn't just about paperwork. It's about creating a detailed roadmap. It tells the surgeon everything they need to know about the hernia's size and location, and it helps them pick the absolute best surgical strategy. To get that precise map, surgeons use a clever grid system like this one from the European Hernia Society. You can see how it's broken down. The grid on the left tracks hernias right down the midline of the belly, from M1 to M5. And the one on the right maps them on the sides, the lateral wall, from L1 to L4. It lets them pinpoint the exact location and size, which is absolutely crucial for planning.
But it's not just about the hernia itself. The patient's overall health is a huge piece of the puzzle. A healthy person is considered low risk, but other factors like smoking, obesity, or diabetes bump them into a higher risk category. And if there's an active infection, well, that's the most challenging scenario of all. Now, in some really severe cases, surgeons face a pretty wild challenge called loss of domain. This is when so much of the abdominal contents have been living outside the abdominal wall for so long that, well, they just don't fit back in anymore. The best analogy is trying to put toothpaste back in the tube. It's a major surgical puzzle to solve. All right, we figured out how to diagnose and classify the problem, so let's talk about what has to happen before anyone even steps into an operating room. Because a successful repair doesn't start with the first incision. It starts weeks, sometimes months beforehand. This whole process is called preoperative optimization. It's basically a multi-step game plan to get the patient into the best possible shape for surgery. And let me tell you, it makes a world of difference for a good outcome and a smooth recovery. First things first, and for smokers, this one is non-negotiable. You have to stop, and ideally at least 4 weeks before the surgery. Making this one change can dramatically slash the risk of wound infections and breathing complications. It's huge. Next up, weight management. We know that obesity raises the risk of complications and the chance the hernia could come back. So for patients with a higher BMI, surgeons will almost always recommend a weight loss plan before scheduling the repair. And for patients who have diabetes, getting blood sugar levels under tight control is absolutely vital. Good, stable blood sugar is one of the secret ingredients for proper healing after an operation. It's that important. So the patient has done all their homework. They are optimized and ready to go. What happens next? Let's open up the modern surgeon's toolkit and see what techniques they're using for the repair itself. This is such a cool image. It shows you the different layers of the abdominal wall. Now, to fix that hernia, surgeons will often use a special surgical mesh. You can think of it like a scaffold or a super strong patch that reinforces the weak spot. It's one of the biggest reasons we've seen a dramatic drop in hernias coming back. So when it comes to the actual surgery, surgeons have two main paths they can take. On one hand, you have traditional open surgery. This means a larger incision, and it's often the go-to for really big, complicated hernias. On the other hand, you've got minimally invasive surgery, which uses tiny incisions and a camera. Each approach has its own set of pros and cons, and the surgeon chooses what's best for the patient. This slide does a great job of breaking down a common open repair into 4 key steps. It's like a surgical dance. Step 1, you expose the defect.
Step 2, you create the space for the mesh. Step 3, you carefully position that mesh. And step 4, you close up that strong tissue layer right over it. And here you can see those 4 steps in action from a real procedure. The surgeon dissects down to find the hernia. They create that perfect pocket behind the muscle. They lay the mesh in there so it's nice and flat, and then they stitch that strong fascia tissue over the top. It's all about creating a strong, durable repair. So, we've walked through the whole journey of hernia repair, from diagnosis and all that crucial prep work to the nitty-gritty of the surgical techniques. Let's step back and pull together the main takeaways. You know, if there's one thing to take away from all of this, it's that modern hernia repair is a true partnership. It's a team sport. It's not just about what the surgeon does in the OR. The patient's commitment to get it ready for surgery is just as important. That collaboration is what really creates the best possible outcome. And that kind of leaves us with one last big thought. As all these surgical repairs keep getting better and more advanced, maybe the next great frontier is figuring out how to stop these hernias from ever happening at all. You know, what if the future of repair is actually prevention? It's definitely something to think about.